Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. We are flying through winter in my mind. I don't know if anyone else feels this way, but I don't know. I think I said this last time. It's been like the first year of my life where things just seem to, like, ever since the holidays wrapped up, it's just been like pedal to the metal and nonstop things to do and weekends. Sometimes you get like some downtime. We did get downtime, not like by choice this past weekend because everyone was sick. So it like forces you to and don't worry, I'm not sick anymore. But but that kind of forces us to go on the couch. It's like, all right, slow down. But yeah, I'm happy about it. I mean, spring's around the corner. There's lots of fun stuff that we're planning, and then summer is behind that. So the best months of the year, in my opinion. But anyway, today we are continuing our family healthcare series with Hackensack Meridian Children's Health. We are speaking about an interesting topic today. We have Dr. Dena Arumugam on the podcast today. She's a board-certified gastrointestinal surgeon who is an expert in minimally invasive laparoscopic, robotic, and bariatric surgery. She has vast experience in a wide range of inpatient and outpatient procedures. You will find her to be attentive, caring, kind, and knowledgeable in formulating a customized surgical plan that best suits each patient. We are going to dive in a bit to childhood obesity today. We're going to talk about surgery, what parents' options are. I think this is, a topic that gets talked about a lot, but also kind of like what the actual options are for parents, yeah. and then like what leads to obesity, kind of the factors. I'm interested to know a lot about what parents ask you, kind of what leads them to seeing you, right?
Sure.
I saw the statistic here: the current and long-term health of 14.4 million is affected by obesity, making it one of the most common pediatric chronic diseases. That's like staggering, that statistic.
Yeah, it's a really big number. First of all, thank you so much for having me here today. It's a big number. It's been a growing number in our country over the past decades. So it's really something we have to focus on and try to put everything we have into it to try to help our adolescents to overcome that.
Wow. So what are some of the factors that lead to obesity? Is it genetics? Is it a combination of things? Is it mostly diet? I'm really curious about that.
Yeah, so it definitely is a combination of things. Obesity over the past 10 years or so has now been identified as a disease in and of itself, just like diabetes is a disease or high blood pressure is a disease. And we know that it's multifactorial. Genetics is definitely something that plays a role. Economic status plays a role, social influences, hormones as well, metabolic things, side effects to medications, things like that. So there's really a whole lot of different aspects that play a role in the development of obesity.
Wow. So why has obesity risen so much then, if it is a disease, and what are the factors that have kind of made it so much more common in today's day and age?
Yeah, that's a good question. I think a lot of it is probably more of the social side of it. Mm-hmm. So it has to do with cost of food, access to healthy foods. Fast food, it's around every corner. It's easy to get. It tastes good to kids.
Right.
But it's not healthy. It's definitely cheaper, but it's not healthy for you. So I think that's a big part of it. Portion sizes have grown
Right.
over time. And then, food is one side of it. Exercise activity is the other side of it. So we're definitely seeing more time on screens, more or less time outside being active and playing with your friends. And, there's sort of like a different focus, I think, over the past few decades or decade or so that has really sort of shifted priorities maybe for how we're what we're allowing our kids to do. And I think that's something that it's hard to sort of back away from because it's everywhere too.
Interesting. So what are some of the treatment plans if a child comes to see you as a patient? What do you recommend, like certain things first, or are you kind of the last stop in terms of where they're coming to you for surgery?
Yeah, so typically I'd say, I'm usually the last stop. Most of the long-term care happens with the pediatrician, sometimes a subspecialist within pediatrics, so gastroenterologists or endocrinologists, nutritionists often get involved as well. But definitely it typically starts with the primary pediatrician. When they're watching children over the course of years struggling with their weight and really having no progress in getting control over the weight, despite all the efforts that they're putting into it. So for anyone, adults, children's, we always start with diet and exercise. That is the sort of the mainstay for any kind of healthy eating plan or weight loss plan. And it has to do with increasing some of the good foods and decreasing some of the not so good foods. It has to do with being more active and exercising. So I think for everybody, that's where it starts. There's a step up above that, which would be what we call behavior modification. So that's really close follow-up with a specialist, whether it's a nutritionist or a doctor, to really try to sort of closely monitor the progress and see they're doing well. This is working for them. They're sort of on the right path, and things are going great. And that has shown to actually help outcomes as far as weight loss goes too. After that, we can start introducing medications for weight loss, and some of the common ones we're using now are the injectable medications, which we're kind of hearing all about. And they're good. They work. They have, often very good success rates. We're helping patients lose somewhere around 15% or so of their weight on some of the injectable medications. What the medications do is that they help with appetite suppression. So there's actually signaling to the brain regarding appetite. So it promotes smaller portion sizes, less snacking, healthier food choices, things like that, which overall promotes weight loss. But we start medications, again, only in conjunction with close follow-up with doctors and specialists, just to make sure that everything is sort of working smoothly, side effects are low, things like that.
So what is the age requirement for that? Is there one?
Yeah, so we usually start talking about medications in like the teen age, 12, 13 and up.
Got it.
And some of the medications are approved for use in the teenage years.
Interesting. Okay. Yeah. Surgery.
Yes.
Is there an age requirement for that?
So it's sort of like loose guidelines. We're starting to think about surgery even as early as age 13 and up. But, it's really also patient dependent for sure.
Got it.
So we'd like to see that all those other things have been tried first. We don't like to sort of jump to surgery. We want to make sure that everything else has sort of been exhausted and there's really no progress with weight loss without surgery first. Other things that come to play are adequate support at home. So we need the whole family to be on board with the plan for surgery.
Right.
Because it really is a lifestyle change that's involved, behavioral changes that are involved, and those are lifelong changes. So we need to make sure that some of those obstacles, like we talked about before, about access to food and healthy food options and exercise abilities, we need to make sure that that's being reinforced and encouraged long term. Otherwise, surgery won't be successful either.
Interesting. So let's backtrack a little bit, because if you and you mentioned, so if a child is seeing a pediatrician and perhaps going to see then also a nutritionist, and adding exercise to their daily routine or enhance movement, right? Will most children find success in just that, or is it like a specific disease that a good portion of these children have, that they won't really see those results that they do need, like to continue different treatment options.
To do more. Yeah. So in general, again, this is children's and adults. What we're seeing is achieving about a 10% weight loss or so, 5 to 10% weight loss with aggressive dietary changes, exercise, things like that is doable for most people, actually. The concern happens with long-term maintenance of that weight, because it tends to be a little bit more of a problem in losing the weight and then just keeping the weight off as well. But yeah, definitely some success just with sort of strict changes in diet and exercise. The question is that 10% enough really to get adolescents or adults down to a healthy weight category where their other health comorbidities and risks are decreased also. So the whole goal of weight loss surgery and weight loss programs and weight loss medications is to reduce the risk of development of other medical conditions.
I see.
So those are things like diabetes and heart disease and blood pressure problems and cholesterol problems. And we know that by reducing the weight to a healthier weight category, we're seeing improvements in those other medical conditions as well. So that's the overall goal. It's not just about the weight loss, but it's about making the patient healthier through weight loss, reducing their chances of developing those conditions, or sometimes treating and curing those conditions.
Interesting. When you see like a really young child that is, looks obese, right? Is that something that they're like kind of born with, or is there like underlying factors to that, or is is it mostly usually like a diet issue?
It's definitely multifactorial. So sometimes definitely we have to rule out genetic causes, syndromes, things like that could promote overeating or excess weight gain. And those are things that are oftentimes harder to treat with just diet and exercise. But yeah, sometimes there are underlying like syndromes that are associated with excess weight.
Oh, and that would be something that is like more of a mental thing that needs to be treated, or more of like just like the way your brain operates, I guess?
Yeah, exactly. So sometimes it's like underlying disturbances in the metabolic pathways that are inside of us. And those things can get treated in other ways, in medications and things like that. But they're a little harder to overcome because of the underlying genetic abnormalities.
Got it. So jumping back to when a child is a candidate for surgery, is there like a certain I guess weight that they have to be? Do they have to be considered like morbidly obese? How does that work?
Yeah, so we use a couple different things actually to decide who's a candidate for surgery. One is the BMI, the body mass index. That's a calculation that uses a person's height and their weight, and it sort of spits out a number based on this calculation. And we start thinking about surgery at a BMI of 35 and above if there's already another comorbidity. So if a 14-year-old is struggling with high blood pressure, that would be a comorbidity. So if their BMI is 35 and above with a diagnosis of high blood pressure, then they would be a candidate for surgery, actually.
Right.
Otherwise, if they're completely healthy but they're just struggling with their weight, then we use a BMI of 40 and above. Same criteria we use for adults, actually. The only difference with children is that for height and growth, we use the CDC guidelines, which gives like a percentile weight typically. So we can also use that for adolescents. And then in that case, we use greater than 120% of the 95th percentile or 140% of the 95th percentile. So that would be like equivalent to the 35 and the 40 BMI.
Interesting. So is this surgery something that was newly approved, or have you been performing on children for a long time?
So the surgery has always shown benefit in children for weight loss. It's just not as common as we do it in adults because it's a little more, we're a little bit more nervous about it in children. It's elective surgery. So it's always been approved. There's always been data to support the benefits of surgery even in adolescents. Our program was recently approved as a comprehensive center. So we are treating weight problems fully. That's our goal. So we've been approved as a bariatric center for over a decade. This was specifically for adults. We would occasionally do adolescent surgery as well. And then this past year, we now are certified in obesity medicine, which is management with medications, and adolescent bariatric surgery as well. So really what we're trying to do is we're trying to educate our community about the options that are available for adolescents. And we're trying to do it safely. So we've really just sort of brought together a group of specialists and doctors who can provide the best care for our patients as far as weight loss goes.
Interesting. So how do you talk to kids? How do you recommend parents talk to kids about movement, right? Maybe your child is just, really likes video games. Like I have two very opposite, like polar opposite children. And one is like, wasn't really into sports and stuff. He was more into like the drama, like plays and stuff, not the drama. But he liked, video games, and he was just that type of kid. And my daughter's like flying off the wall and can't sit still. Yeah. So, how do you, and there's a lot of kids out there, right? Especially now with screens, with just how like our lives are run, that they're maybe a bit more sedentary than we were. We talked about this a lot, especially because I went out with some of the moms from my daughter's school last weekend, and we were talking about how like kids don't really set up play dates anymore, especially like in their 8. My daughter's 9, and like I've found that, I think too, because like of so many different factors, like just not setting up play dates because like you are nervous to like send your kids to like someone else's house, right? Yeah. Where like when we were kids, like I rode my bike all over the neighborhood, and it was just kind of like, I don't think my mom, there was no cell phone, so she definitely had no idea where I was. She had like an idea, it was like, okay, I'm going to Joanne's house, I'm going here, I'm going wherever. And like we had a creek, well, my mom still lives there, but there's a creek in the back of my mom's house, and it's actually a lot bigger than now it's like a lot bigger. But at the time it was like this creek, and I would go back there and like in the woods, right? It was like in the back of our house, and we would like play with the like frogs. I would look for fish and stuff, and like I don't think she'd survive like doing that. She just wouldn't. And we live on a street that is a bit more it's like on an incline, and it's also like a cut through because of I think Waze and like all the different apps. So it's a neighborhood, but it's like people fly down my street. Yes. So I don't let her ride her bike on our street. It just makes me nervous. Yeah. So there's just like a lot of different factors as to like how she's growing up and how we grew up, and that's just reality. Like it's this can't be changed. But she's also active in different ways, and we just live different lives. But what would you recommend to say to parents when you do have a child that maybe isn't like as inclined to go out and do different things or sign up for different things that moved? Maybe they're into STEAM, right? But you're not really moving, right? What does that look like?
Yeah, so I think it's helpful to get the whole family involved. Definitely what we don't want to do is we don't want to sort of focus in on one child who's having problems with their weight and trying to give them that sort of negative attention about becoming more active. So instead, I think it's important to do it as a family. Right. And what I find with my kids, because they're like that too, they love playing on their iPads and Roblox and whatever else is going on. But what I find is that once I get them outside, they're fine. They actually enjoy it once they're out there. They're creative, and they do all the stuff that we remember doing as kids too. And I think we just have to sort of give them the opportunity to explore, because that's what kids do. They sort of explore and they find whatever I think is going to work for them and give them enjoyment. Yeah. So I think that's a place to start at least. Or, we just have to be more strict about we're only going to spend this much time on our screens, or we're going to spend this much time outside every day. I think that, but again, I think it's important to do it for everybody all together. Yeah. And probably starting from a young age too. Definitely. Yeah. Because when it's like a bit more ingrained, like if you're going to, it's routine. Yeah. And if someone's, a kid's like 11 and you're not an outdoorsy person, you're like, guess what we're doing today? We're going hiking. They're like, what? No surprises. Yeah. Oh, that's interesting. And what about diet? Like in terms of, maybe a family is really into, maybe they're living a very busy lifestyle and they're just living on the road and, in terms of activities and all kinds of extracurricular things that they're doing. So fast food is like a constant, right, in their lives. It's probably a tough conversation to have with like a parent because maybe their entire family lives that way. Right, exactly. Yeah, for sure. And it's definitely an obstacle that we're facing right now, I think. I think making small changes is cumulative, right? So that's what I tell all my patients is start out with something small. If the kids are drinking a lot of juice or soda, cut it out or half it, and then next week you cut it out. Like, so just sort of make those cumulative small changes that over time, maybe aren't noticed as much.
Okay.
And I think that that's easier to stick with too.
Yeah.
And I found that happen in my patients who've had surgery is day one, they just quit drinking soda. And it's great for them, but I think it's hard to do that for a lot of people.
Right.
So I would say if you're eating out, 4 days a week, try to make it 2 days a week. Try to do some meal planning ahead of time. Have things on the go that if you're driving off to basketball practice and soccer practice, you have something that's a little bit healthy and nutritious that you can offer that's not just, running to close fast food.
How much of it do you find is mental, and how much of it is something that like you really, so for instance, I find that like if I'm really trying to think about what I'm going to eat that week or like not eat or whatever, you kind of like, I'm very much like, I like balance. So I kind of have always just been like, okay, I eat this, but then I like the next day I'll have like a little bit less because I ate maybe like steak and cheese fries or whatever, but if there are weeks that like I do become a bit more like, oh, I ate that and whatever, and you're like always in your head and it's just constantly mental versus like not really thinking about it and just making these decisions to like have healthier things sometimes. And, it's not realistic to just constantly eat like, broccoli. Like it's just not.
Right. No.
So how much of it is like, because it's like this self-fulfilling thing where you're just constantly like always thinking about what you're eating. So you just end up eating more. And do you find that like a lot with your patients?
Yeah, I think for adolescents, a lot of it probably has to do with just what the family dynamic is because they don't have as much independence in choosing what their meals are going to consist of. That's why the family support is really important in the whole process for adolescents. But definitely, if there's less snacks around the house, they can't eat the snacks as much, right? So it definitely takes a lot of work then on the parent side of things to do that also, which again is hard, I think, a lot of the times. I think we definitely don't want to encourage being obsessed with food either, because even if it's being obsessed with healthy food, it's not a good thing for our kids, and I think that definitely makes a lifelong impact on their relationship with eating.
Yeah.
So, I tend to suggest less restrictive as far as never eat, don't ever eat these things. I don't like to tell people to do that.
Food isn't bad. It's food.
Exactly. It's food. It's nutrition. Your body needs it.
Right.
But to be mindful, but, just to try most of the time to make good choices. You're not going to be 100%, and that's okay, and don't kill yourself over it if you're not. But to also, aim for making healthy choices a lot of the time. If the goal is for improved health and improved weight loss and things like that. And we all go in stages, as far as this is a really busy week for us. We just can't make it happen. But, next week we try to do better, I think.
Right.
It's about balance.
Trying to be balanced.
Doing our best.
And moving your body. Is there certain exercise recommendations that you have for children? Like, is there a certain amount of time per day, or is it different for every kid?
Yeah, I think a nice goal is to be active about an hour a day for kids. And some of that happens at school, in gym and recess and things like that. If we can add more to that at home, I think that's great.
Okay. We touched a little bit on weight loss medication. I think we talked a little bit before we went on air about the semaglutides and the Ozempics have become much more present, right, in conversation over the last year and a half, I'd say.
Yeah, for sure.
I think initially they probably had a bit more of a negative connotation because, just from like seeing things on social media and like knowing a few people that have done it, you get like that Ozempic face, I believe people have said, where you get like a drawn face almost or something. I don't know if that's true or not.
I've never heard of that term, actually.
Yeah. And then also, like the benefits and if there are any risks to it, especially with children, because I didn't know that it was approved for teens.
Yeah, so Ozempic actually is specifically approved for diabetes management, but there is an equivalent medication called Wegovy that is approved for weight loss.
I see.
Same exact medication and just different indications.
Okay.
Saxenda is another medication which is similar, but just the frequency of the dosing is a little bit different.
Mm-hmm.
And those medications have been approved for weight loss in adolescents for a few years, but they've only become, sort of popular, and everyone's sort of talking about them recently
Because they work.
because they work. Yeah, actually, that is a big part of it, and I do think they work. Studies are showing anywhere from a 10 to 15% weight loss on the medications. Definitely in conjunction with healthy eating and exercise, and that's a great number for people who have tried everything else and are still struggling with their weight. So recommendations through the Academy of Pediatrics is to trial some of these medications on any adolescents that have struggled with their weight, that meet those BMI criteria, and that just need a little extra help in their weight management.
Interesting. But you're not on them long term. It's a treatment plan. How does that work?
So technically, typically some medication is necessary long term.
Oh, it is?
Yeah.
Okay.
So we're treating obesity like other diseases. Diabetes requires long-term medication. We're treating obesity sort of the same way, because typically what happens is that when the medication stops, then the weight does tend to regain.
So if they continue to stay on a certain dose, they'll continue to lose weight, or you to prescribe the medication until they get to their ideal weight?
Yeah, and we don't always achieve ideal weight actually on the medication, but we look for, like I said, about a 15% or so weight loss.
I see.
If they're not achieving about a 5% weight loss, then the medication just probably isn't going to work for them at all.
Got it.
But we're hoping for somewhere about 10 to 15%, and if we're seeing that, then that doesn't mean they're sort of done and over with and everything's all good. It still requires sort of that constant reinforcement of the healthy eating and follow-up to really help maintain the weight loss too.
Are there any side effects?
Yeah, most of the side effects are GI related, so things like nausea, abdominal cramping, diarrhea, constipation,
Okay.
fatigue, things like that.
Okay.
It seems like over time the side effects do decrease for most people. Some people have really bad side effects to it and just don't tolerate the medication.
I see.
But most tolerate it, I would say.
Yeah, I have a friend who's taken it, and she's said that it was the biggest thing was the fatigue. It's makes her her days are shorter just because she's it makes her a bit more tired. But overall, she's had a really positive experience with it. So
yeah, the people that respond well to the medications are really, really happy on it because they've tried everything and it hasn't worked. So the medications are kind of giving them that sort of hope that something's helping them now and they could be healthier through weight loss.
And it's probably too, like you said, it motivates them to
Absolutely.
once you get to once you get to your goal, right, you don't want to let it go. So you want to incentivize yourself to continue to, maybe move more and eat healthier and stuff like that. So it's probably helps as a combination of factors.
Definitely, yeah.
So where do you treat your patients?
So I see patients at Hope Tower down in Neptune, affiliated with Jersey Shore Medical Center.
Okay. And you specifically focus on surgery.
Yes.
And then you work with other doctors that would prescribe different medications and then conjunction with the pediatrician.
Exactly, yeah. So I'm an adult surgeon, actually. I'm trained in general surgery and bariatric surgery, which is weight loss surgery. So the majority of my patients are adults, but because I specialize in weight loss surgery and the pediatric surgeons typically don't, I've taken on that role with the adolescents, but I work closely with the pediatricians at Hope Tower so that we can really provide that sort of comprehensive care to the patients.
Interesting. Well, you're doing amazing work and probably helping so many kids, feel better about themselves. So those years are rough, and it's probably not, an easy thing to go through when you don't feel good about the way that you look, right, and how you feel. And we didn't even get into this, but all, the health risks, right, that come from obesity. So I'm sure that you're helping lots of families.
Thank you. I hope so. I do.
Yeah. Well, thank you so much for coming on. This is really
so much for having me.
Helpful information. We are going to link all of the information in the podcast details here so you can find the services if you wanted to set up an appointment and learn more from Hackensack Meridian Children's Health. So thank you so much.
Thank you so much. I appreciate it.
Next up, we have, I'm actually going to be doing a new podcast coming up to talk. I keep talking about this, but we're going to do something to explain a little bit more about what we're doing for the summit. And then also I want to talk about our spring festival, which is coming up May 4th. it's like I can't believe that this spring is like almost here and it's flying by. So we have a lot of cool stuff happening with Mom with Moms events we'll be talking about soon, so stay tuned for that. Also coming soon, we have another thing that like just snuck up on me is St. Patrick's Day parades and events and stuff. So we're going to be putting that on the site. So check for that soon. And then Easter. Easter's early this year. So anything like spring related, we usually do like an Easter egg hunt post with all kinds of spring activities and events that are happening in the community. So we're going to be putting that up also within the next like week and a half. So check for that and more. And as always, check on our events page for everything happening in Monmouth County for the spring, because now we're going into the busy season, so there'll be lots to do with the kids. We'll have all the fun stuff happening. So look for that and more. And thank you for listening. Have a great day.
I'll just say that I'm a huge fan of you, and you've helped me plan my weekends out with my
thank you.
kids, and it's been great. So thank you.
Thank you. Well, thanks for coming.